Thanks for your company this morning. Top doctors across the country are calling for a crackdown on the billion-dollar cosmetic surgery industry. For decades, weak regulations have allowed doctors without any formal plastics training to perform cosmetic surgeries, putting patients at significant risk.
For more, we're joined by Dr. Patrick Tansley, the President of the Australian College of Cosmetic Surgery and Medicine, who joins us now in Melbourne. Patrick, great to have you on. So why is any doctor able to call themselves a cosmetic surgeon in this country?
Well, David Brooke, good morning. Thanks for having me on the show. It's really historical. Cosmetic surgery in a modern form is relatively new. It's only been around for 4 or 5 decades, whereas the traditional surgical specialties have been around for much longer than that. As a consequence, the traditional medical surgical training programs generally don't include cosmetic surgery. Society has moved much faster than traditional medicine has followed, and as a consequence, cosmetic surgery is not recognised as a specialty. It has no protected title, and therefore it's quite legal for any medical practitioner at this time, under current legislation, to call themselves a cosmetic surgeon.
Now, this statistic is absolutely astonishing. 20% of women who have received breast implants might need surgery to fix botched procedures. How dangerous are these weak regulations for patients?
Well, of course, the 20% data, which has recently been published, is unverified, and I haven't seen any supportive information relating to that. But of course, all breast implants have problems. None of them are lifetime devices. The really interesting question is who performed the botched procedures. And whilst that's been ascribed to cosmetic surgeons, if we look at the actual published data, for example, the Australian Medical Council associated reports, they show a rather different picture. The 2017 report suggested that plastic surgeons train in Australia with a deficit in experience of cosmetic surgery and in fact qualify with a gap in that area of practice. The 2021 report just published says little different. And so I think we really need to look at that 20% figure in more detail to find out exactly who has performed such botched procedures.
These things are expensive, and the people who are going for them are people who, the cost of living is hard for them at the moment. They need to do this for whatever reason, and sometimes it's just cosmetic, sometimes it's for other reasons. It's an expensive thing. Why isn't this regulated? You say it's like 4 or 5 decades behind and, it goes really fast. Why can't we just change the law to regulate it so people are safe in this country and know where they're spending their money is the right place?
Well, this is exactly what we have been advocating. In an ideal world, the law would be changed to recognise cosmetic surgery as a specialty in its own right. Unfortunately, current legislation does not allow that because a medical specialty, in order to be recognised, needs to service a burden of disease. Cosmetic surgery, by definition, does not. For example, a breast augmentation. In recognition of that, the solution that I have advocated to government is using a different area of the national law, which is under Section 98, and that refers to the concept of endorsement. Endorsement would require any medical practitioner, a cosmetic surgeon, a plastic surgeon, a cosmetic plastic surgeon, or any other specialist who wishes to perform cosmetic surgery, to be recognised and trained specifically in cosmetic surgery. And then government, not the industry itself, would regulate the process by having an independent register on AHPRA's website so that the public can look at that website and identify specific practitioners who are trained, safe and competent in cosmetic surgery.
So for people who are looking into getting a procedure done, is there a way to tell if the doctor has had some specialised training?
At the moment, that's very difficult, and that's why I've suggested that the endorsement model is the way forward. I think it's the only pragmatic, safe way that this problem can be solved relatively easily. In the absence of that at this moment, members of the public should be very careful when they select a practitioner to undertake cosmetic surgery. They should make sure by asking them specifically what training they have had in cosmetic surgery, ask them how many of a particular procedure they have done in the last year, always seek a second opinion, and if they're not satisfied with that, simply walk away. Do not have surgery with a medical practitioner with whom one is not comfortable. And I can't advocate that advice strongly enough. Cosmetic surgery has different skills to reconstructive plastic surgery. I can say that as a British plastic surgeon by background on the United Kingdom Register. And it is important that any medical practitioner who is going to undertake a procedure on a patient is properly trained specifically in cosmetic surgery.
Well, Dr. Patrick Tansley, some gut check stuff that people need to do there as well, I think is what you're suggesting. But hopefully those regulations and those recommendations that you're putting forward to government come through, because I think we really do need it. Thank you so much for your time.
Thank you. Still to